My name is Michael Greenberg, Chairman and Chief Executive Officer of Fio Corporation, based in Toronto, Canada. I trained in neurosurgery in Toronto in the United States, and thought I would be a neurosurgeon for my career. I noticed that I could touch many more patients if I invented tools for neurosurgery than I could see if I did neurosurgery alone. And that led me to create some technologies, and they grew into companies. Built the world's largest medical imaging software company with software that was used by GE, Siemens, Philips, Toshiba, Hitachi in diagnostic scanners. And also we invented image-guided surgery. So I was introduced into high-tech business, and I enjoyed it a lot. My work could touch millions of patients, which I could never have done if I did only clinical medicine. Fio came to my mind when I realized that all of the MRI and CT and nuclear medicine and ultrasound technology that we created the software for really apply to a very small portion of the world's population. The vast majority of the world's population wouldn't see an MRI and maybe didn't need to see an MRI. And so I began to think about technology that could affect much larger populations, and that led me to create Fio, where we create a very advanced high technology in the same way that a cell phone is very advanced high technology, but could be used by almost anyone. Fio does is we create mobile smart devices that help health workers deliver much higher quality of health care. It guides them through the workflow, through the way they talk to patients. It guides them through the questions for point-of-care diagnostic tests. It automatically reads these tests. So it takes an ordinary health worker and allows them to perform at the level approaching an expert, and allows them to do tests at the level approaching an expert technician. All of the time, in order to advance through the workflow, they're touching the screen of the device, and the device reads the tests, and all of this information is captured, encrypted, uploaded using cell networks to a cloud from which the supervisors overseeing the health workers can for the first time see what they do every moment, and also to direct them. And then the health provider itself can use our software to adjust the workflow of the health workers, to adjust what they do so that there's better quality of care delivered, and also maybe better economics of care delivered, because there's a lot of waste in the healthcare system because people don't really know what activities and what outcomes are associated with those activities. We capture all of that. We are dedicated to delivering this technology to developing and emerging countries. So we've launched in Latin America and Colombia, in East Africa, West Africa, now Central and South Africa. Our technology is also used by advanced groups such as the U.S. Walter Reed Army Institute and other elements of the U.S. Medical Defense Group, large companies in Europe and North America. We've always dreamed about coming to India, and this has begun recently through a partnership with Apollo that we are developing. Apollo has the same vision that we have, which is to take high quality care, which exists for the relatively few, and extend it to the relatively many, to the many, many. And in order to do that, you have to have a way of putting high quality health care in a form that can be projected to where the vast majority of people are, which is not necessarily in urban centers. So Apollo has pioneered an excellent telehealth program. And what we do, which is artificial intelligence in mobile smart devices linked to cloud services, is a wonderful companion to that. And so the two companies together are exploring how to deliver much higher quality of healthcare to many more people than has ever been done before here in India. Started a pilot just a few months ago. We've been very lucky. It's going very well. I guess it's due to the quality of our partner in Apollo. So far the challenges have been just what they always are, which is to make sure you deliver your technology properly and support it. No special challenges. It's gone extremely well. I'm sure there will always be challenges, but it's only been a couple of months, and the partnership with them is very strong. As issues come up, they get settled almost immediately. Well, generally, there's going to be a major shift in this world. Generally, devices that do things for patients, like make diagnoses, are separate from data. There's data systems in one sphere, and then there's devices that do diagnostic care in another. There's care delivery by health workers in their millions across the world, and then there's data capture as a separate domain. These two will have to come together. Every diagnostic device should be a moment of data capture. Every conversation between a health worker and a patient should be a moment of data capture, because that's very rich information that will affect two things. One is the quality of care this patient will have, and the other is the efficiency of care that the health system can deliver. Those two will come together. We probably represent the first, but I'm sure others will follow. In a sense, every stethoscope should be recording what the wearer of the stethoscope is listening to, and that data should be captured and used to make the health system more efficient and of higher quality.